Oh, something.
What is, oh, you want to turn it off until you're ready to speak? Oh, here. You know what? There's no like, I guess there's no adjustment. So if you just want to move it away from your mouth, you know what I mean? Yeah. And you're not that loud. I usually have like right here.
Are we good? Is on the class and everything recorded?
Yep.
Okay, perfect.
Yep.
And people are popping on virtually too. I think it needs to be.
How are you?
Everyone looks like they're ready for a class. Is it cold? All right. And then I can touch this and never feels like it. No, it's hot enough. It's just bumped it up slightly. I'm gonna have a mat and everything.
Alrighty. Let's see in here. Hey! It's me!
Do you want us to sit down or stand awkwardly?
You guys can sit. Yeah. No, be comfortable.
It's just waiting for you.
Sorry. I will start out and stand. So everyone can see and hear me, okay? Let's turn you down, Leon.
You're like not too low. Here, do you want me to turn it down slightly? So it's,
Yeah, slightly. All right. Are we all set? Is this everyone?
I think we're missing some, but maybe you start and then I'll catch up. I'm also recording here. I don't know if it's like awkward to turn. Maybe if you just stand here, then they can hear you.
Okay, perfect.
And if you don't mind using the mic, then I think they can hear you better
Okay.
from the. If Melissa, hello. Hello, Melissa, Janine. Just type in if you can't hear us or anything like that. I guess you wouldn't. You wouldn't know. We'll find out. I feel like eventually they would type something.
Somebody
type something.
Oh, I can hear you.
Okay.
Okay, perfect. All right. Well, I'm Alexa. I am a pelvic floor physical therapist. Sorry, I'm just going to be on this a lot because, you know, music is a vibe, right? I'm Alexa, pelvic floor physical therapist. I work over at Flourish Pelvic Health and Wellness, which is in Fort Washington, right down the street. Just find the best place for this.
Yeah, it should connect. There you go. I'm just tilting that.
Perfect.
All right. I also have a background in powerlifting, in exercise, and personal training. So I'm very exercise focused. I'm also trained in postpartum athletics, return to sport. I also treat men. I do not treat infants or babies, but we do also offer that at our clinic. We have two amazing OTs that both work with women and children, both with pediatric pelvic floor therapy and also just regular occupational therapy. And then we also have a birth collective with multiple services in it. But today we're going to learn a little bit more about the pelvic floor specific to exercise, and I will have you exercising just a tad, but a lot of it will be a lot of breathing and focusing on your pelvic floor, okay? So pelvic floor, so this is your pelvis, okay? Obviously right here. Everyone has a pelvic floor. No matter who you are, what you are, you have a pelvic floor. Not sure about animals yet, but basically inside the pelvic floor is your deep pelvic floor muscles, and these work to stabilize you just like your deep core muscles. So your pelvic floor is essentially a deep core muscle. Externally is almost like vulva looking, but it's underneath the vulva. There are specific muscles that kind of outline the vulva as well. So these are going to be more specific to urination and also evacuation of bowels. But typically, right in the middle of your vagina and anus is your perineal body. So if you've had babies and you've had a vaginal delivery, this is typically where you tear, okay? So it's important to look not just inside the pelvic floor, but outside externally too. Now inside the pelvic floor, it's going to hold your bladder, your uterus, and your rectum, and for male anatomy, prostate. But typically, if these muscles are dysfunctional, they are not going to hold those organs as well. Therefore, you might have some leakage. You might have leakage of urine. You might have leakage of bowels. You might be constipated. You might be retaining urine. You might have painful sex. You might have painful GYN exams. And you might not be utilizing your core as much as you think you would with exercise. So that's kind of what I'm going to teach you today. I also do want to note the anatomy of the abdomen. So if your pelvis is here and your abdomen is up here, we've got multiple muscles in your abdomen. So we've got your six pack, which is your rectus abdominis, going straight up and down. So like your crunching motion, you're lifting your legs motion, also with your hip flexors. You've got your obliques on the side, so anytime that you're leaning down to the side or doing your side plank. And then underneath of that, you've got your transversus abdominis. So those fibers go horizontal, and as they contract, they go this way. So typically, people with diastasis recti or abdominal separation, your transversus abdominis is not going this way. It is stretched. So it could be because of being pregnant. It could just be because of chronic coughing. It could be chronic vomiting. Anything that you're increasing pressure in your abdomen. So people that are always sick and have allergies, we want to make sure, okay, what is your pelvic floor like? How is your abdomen? Are you getting any doning or coning? Are you doing a crunch or a sit up out of bed and making that abdominal pressure even worse? Okay, because then that could lead to pelvic floor dysfunctions. So typically, with your abdomen, your diaphragm, which lines all of your organs and your rib cage, in the front, the sides, and the back, this is your primary breathing muscle. It does 75% of your breathing. So as you inhale, your diaphragm actually pushes everything down and out to create space for the lungs, right? As it's pushing everything down and out on your inhale, your belly is going to rise, your ribs are going to expand, and your pelvic floor is going to lengthen. So typically, as women, we're always taught up and in. Keep it up and in, right? But when you're inhaling, everything is coming down and out, okay? So that's like a misconception that everyone is thinking about. Now, I don't mean to say this to say this is your primary source of breathing, diaphragmatic breathing, because it's not. Because if we were to walk around and just focus on inhaling and expanding everything all the time, our brain is gonna get super confused. So utilize this type of breathing when you're focusing on your pelvic floor, AKA when you're doing heavier lifts in the gym, when you're doing jumping jacks, something where you think you may leak, right? How many of us always just wear black pants because you're scared of something coming out and something showing? But we want to make sure that we're practicing this breathing even before exercise, so that way our pelvic floor and our abdomen and our diaphragm know to be active. Does that make sense? Any questions about the abdomen or the pelvic floor so far? Okay, so what I'll have you practice, we're going to practice some diaphragmatic breathing. Like I said, as you inhale, so I'm going to have everyone put their hands on their ribs to the side. And then you switch hands. So as you inhale, belly, ribs, organs above the pelvis, right? As you inhale, I want everything to open up. Meaning, your hands are going to rise, your belly is going to rise, your pelvic floor is going to drop. If it's too much to think about the pelvic floor right now, just think about the belly, okay? So inhale, pelvic floor is dropping, belly's out in the front, ribs are out to the side, ribs are out, also coming out in the back. Don't neglect that, because if we're too here, it's gonna be counterintuitive, okay? So go ahead and take a nice deep inhale, and just exhale, let it all go. Inhale, and exhale, just let it all fall, okay? So now, typically with what we teach is that on your exhale, everything is coming back in. So naturally, your core and your pelvic floor and your body are bracing, okay? So that nice big inhale is stretching everything out, and then on your exhale, notice it all just comes together, naturally, right? If you were to get a little bit more forceful with your exhale, that's when you really start to brace that core. That's when that transversus abdominis fibers come together. That's when that pelvic floor comes in, AKA a Kegel, yes. However, we're not just focusing on squeezing our butt, squeezing our legs, trying not to pee, right? So as you inhale, we are just kind of dropping that pelvic floor down. The belly is expanding, and as we exhale, everything is just coming to a central point. How does that feel? Does anyone feel the pelvic floor? Not yet? You do? All right, so now go ahead and relax. I am gonna take a volunteer. Not really volunteering, but you know. Come on in. All right. Can I use this mat actually? I'm gonna have you on your back. Oh, let's bring this down a little bit. All right. Let's have your either way. All right. So I'm gonna check Meredith for diastasis, if you don't mind. So lift this up a little bit. Can I pull this down a little? Sure. All right. My hands are cold. Okay. So typically with diastasis, what I'm looking for, I'll go with my fingers above the belly button, I'll go at the belly button, and then I'll go below the belly button. So I'm using all of my fingers. It's important if you do know how to check for diastasis that you always get it rechecked with someone else. I got super small fingers, so 3 fingers for me is not going to be, the same 3 fingers for someone else. So in order to check the abdominal tension, I'm going to have you lift your head. Good. So here we're just getting minimal contraction, not bad. So now I'm going to have you lift your head and slightly lift your shoulders. Good. And relax. This feels great, girl. You don't have diastasis. Sorry, I feel dizzy. Go ahead and lift your head and shoulders again. So now I'm in the belly button and relax. And then last time, go ahead and lift. This still feels great. So she's also not getting any building or pulling. So typically with diastasis, if you notice like hanging knee raises or planks or sit-ups and crunches, if you notice something popping out in the middle of your stomach, that is diastasis and you need to get it checked because you don't also want that to turn into a hernia, okay? She has got nothing going on popping out. There is a little bit of separation in the middle of the belly button. It is not bad. So more often than not, I'm looking for if my fingers really sink in and how wide the diastasis is, how wide the separation is. You've got about 2 fingers, but it's not deep. Not deep at all. Not 3. Because it's not deep, that means her transversus abdominis and her tissues, connective tissue, is still intact. Okay? So this is great. So now what I'm going to have you do, I'm going to keep my fingers here because you have that 2 fingers, and I want you to exhale and brace that core. Perfect. Now go ahead and lift the head. Feels perfect. Feels great. Decreased. Okay? Go ahead and relax. Now I'm going to have you test that once more, but as you inhale into the ribs in the back. Good. Exhale, brace that core and lift your head. This feels awesome. And still, nothing is popping out, okay? So it's important to note that you want to do that exhale with the transversus abdominis contraction or just kind of bracing the core as you exhale. So that way nothing gets worse, nothing starts popping out. And then also think about it this way. If you were to do a sit-up right now without breathing, go ahead and do a sit-up. You're holding your breath, right?
Yeah.
So that pressure has to go somewhere. So if it's not coming out in the belly, it's going to come out of that pelvic floor in the form of leakage, in the form of gas, air. Go ahead and back down. And then now I want you to do that on your exhale. Now it's coming out of her mouth, or her nose. But it's much, much more contained, and it's not going to come out places you don't want it to come out. Okay? All right. Thank you, Meredith. Congratulations on your non-diastasis. All right, so now I'm going to have everyone on their back. For you, do you want, what'd you say? A ball. Perfect. All right, so we're going to practice a couple of the breathing exercises, and then I'll also have you connect to your pelvic floor. Okay. So hands on your stomach, let's say. Let's say one hand on your stomach, one hand on your ribs. And now I want you to inhale into both of those hands. And now I want you to exhale through your mouth. Inhale through both of those hands. And exhale through the mouth. Now on your inhale, I want you to feel like the pelvic floor is slightly opening. meaning your sit bones are coming apart, or you feel like you could pass air. Okay, so inhale into the pelvic floor, into the hands, and as you exhale, just let everything come into the hands. Let's say, it's not necessarily a push, it's more like a drop or a lengthen on your inhale. So if it's too much to think about the pelvic floor, just think about that belly rising and also air filling up within the entire abdominal cavity. So now go ahead and place one hand, let's say, on the ribs in your back. Perfect. So now as you inhale, one hand either on the stomach or the ribs in the front, and then another hand on the ribs in the back. As you inhale, your inhale should go into both of your hands at the same time. And then just exhale. Inhale into both of those hands. And exhale. Good, so you should notice that the back is also going into the hand, right? And if it's not, then we just need to focus a little bit more into the back, okay? But as long as that air is filling up the entire abdominal cavity, your pelvic floor should be relaxed, okay? Whether you feel it or not. So now, both hands, let's say, on the belly, and bring it a little lower down, towards the hip bones. So now as you inhale, same thing. Inhale, fill up the belly. As you exhale, I want you to brace your core towards the end of your exhale. So just let all the air out, try to get all of the air out, and notice if it gets a little hard under your fingers. That is your deep core, it's activating. So that's your transverse abdominis, okay? Everyone feel that okay? Let's try it once more. Inhale, fill up the belly. Exhale, draw in that belly button, brace the core. Feel everything just coming together nicely. Now I'm gonna have you in a bridge. Remember, I want you breathing when you're moving, right? So as you come up into your bridge, let's say exhale. Exhale as you arrive into the bridge. Good. So one of my favorite transverse abdominis exercises is a bridge march, which is pretty hard, I have to admit. But essentially, in this bridge hold, you would just lift a leg. Yep. And then inhale, bring it down. And then exhale, other side. Inhale, bring it down. Exhale, other side. Does everyone feel their core? Yeah, super easy. Well, the exercise isn't easy, but the core engagement is easy. Good, go ahead and relax. Okay, next exercise. I said I was gonna have you do a little bit of exercise. I'm gonna have you on your side, we're gonna do a modified side plank. Now, notice if you're holding your breath as you're transitioning. Keep breathing. Okay, I guess I'll do this too. Let's say bend your knees and have your knees in line with your hips. Either forearm or hand is fine. What I'm gonna have you do is exhale, lift the hips from the floor. And I want you to take 5 good breaths here. As you inhale, try to expand the belly. As you exhale, draw in the belly button. Feel your core working. How's it feel? If you want to make this a little harder, you can kick out your top leg. I like doing this only because that starts to connect the lower body with the core, with your upper body. So you feel those obliques turning on, transverse abdominis is active, and your pelvic floor is automatically turned on here. Good. And you can go and relax. Let's even it out, 6 sides. And just a few breaths here. Lifting on your exhale, and just continuously breathing here. Remember, on your inhale, try to fill up the belly. It will be a little hard because core is automatically turned on. But as you exhale, just continue to draw in that core, that belly button. Good, and relax. All right, so now I'm gonna have you transition into standing. We're getting to a little jumping. I'm kidding. Just like a precursor to jumping, okay? Notice if you held your breath. Did you hold your breath? Did you make your pelvic floor worse? You're not gonna make your pelvic floor worse today. We're gonna get into a couple of squats. So squats are probably the easiest and most functional thing you can do in an exercise, right? Because you're always squatting down to pick things up. You're squatting to get into your chair, into your car. What I like to teach is that inhale and that exhale. So as you inhale, you're going down into your squat. As you exhale, you're gonna feel your motion up, okay? As you're exhaling, that transversus abdominis is coming together, that pelvic floor is coming together, and the air is escaping through the mouth, okay? So let's try a couple spots. Inhale down, exhale up. Inhale down, exhale up. Now I want you to focus. Can you do a Kegel pelvic floor squeeze as you come up? Let's try. Inhale down. Take a pause here. Start your exhale. Try to squeeze everything up as you come up. Have you? We're working, we're working. Inhale, relax it. Break it down. Exhale. Squeeze. Inhale, relax. Exhale, squeeze and lift. All right, so now let's go a little fancy. I'm gonna have you go into a heel raise. Because once we get that momentum going, we're close to jumping, right? Okay, so inhale down. Exhale, squeeze the pelvic floor down onto the toes. I know, that helps. Inhale down. Exhale, come up. Inhale down. Exhale up. Good, how's it feel? I'd say if you are the type that avoids jumping at all costs, practice this, okay? And then you can get a little bit fancier with it, right? Now, this is the hard part. I like this one. Oh, I like this one. This is the hard part. You can't do this breathing all the time. You can't do it with all of your exercises, right? Because you're gonna confuse your body. When you are doing your heaviest lift, your slowest motions in your exercise, that's when you utilize this. So you can practice it, right? You can practice these squats super slow all we want, and then we would go into our faster motions, okay? We don't want to think about this during our faster motions, so that's why we practice it with the slowest ones. Any questions about the pelvic floor? Yeah.
How do you know if you're actually doing a Kegel besides like squeezing?
Get your pelvic floor checked. Like I said, we don't really want to do Kegels often. Because if you don't know if the nature of your pelvic floor, if it's way too tight, you don't want to do Kegels. Because then you can make your pelvic floor so much worse, right? Because it's like a bicep curl. If I'm just bicep curling all the way, right? And I'm not relaxing my pelvic floor, I'm stuck here. So then I can't function. If you do Kegels, do it with this breathing. So that way you know, on your inhale, I'm relaxing my pelvic floor. On the exhale, I can squeeze with the appropriate muscles. And then on my inhale, I'm gonna relax it again, okay? So we want that good balance. You could also look in a mirror. You can do like a self-palpation externally and just see if you're getting a handful of butt squeezing, that's probably not it, right? I always like to say, if you're doing a Kegel, I shouldn't see anything move externally. Does that make sense? Yeah. I know it's tough. The main thing I say is to get it checked by a pelvic floor PT.
Are there symptoms of a too tight pelvic floor that you would?
Yes.
Or is it similar to like the opposite? You know, not.
It could be. So the main symptoms I see is urinary frequency, urinary urgency, any type of pain at all. So like increased painful periods, constipation, pain with sex, just general tightness, tightness pain. Sometimes people also have like vulvovaginal pain, skin disorders. That could be all related to that tight pelvic floor. If you have any numbness, tingling, if you have any type of fecal incontinence, that can also be related to a tight pelvic floor. And then urge and mixed incontinence. So if you have mixed incontinence, that means that you are leaking when you pee, or when you sneeze, when you cough, when you laugh, when you jump, right? That's stress incontinence. Urge incontinence is I'm leaking on the way to the bathroom. I'm leaking when I put the key in the door, right? That's latchkey syndrome. A mix is the mix between both of those. So the mix and the urge can be a dysfunction of tight pelvic floor. But yeah, good question, because we oftentimes think that it's just pelvic floor, I'm leaking, and if I'm not leaking, then I'm good, right? But most of us have painful periods. Most of us have irregular periods. Most of us have pain with sex. It's not normal, but it's very, very common. That's why I say, make sure that you are doing your breathing, that you're connecting with your body, connecting with your pelvic floor, and knowing your anatomy. Just looking at the anatomy of the pelvic floor, the anatomy of the abdomen, knowing if you have jaw dysfunction, right? Jaw tightness can also be related to pelvic floor tightness. I know, it's pretty cool. It's a neurological thing, but at the same time, if you're clenching with your jaw, you're clenching with your pelvic floor. If you always exercise all the time without stretching, your pelvic floor is probably super tight because your hips are tight, right? If you're doing too much yoga and stretching, you're probably not stable, so your pelvic floor is acting as your sole core muscle. So you need a balance. So try to find a balance in life, in your body, and then your pelvic floor will follow. Any other questions? Do we know a little bit more about pelvic floor? I hope so. Main gist of this, like I said, find your balance in your body. But then as much as you squeeze, you need to relax. As much as you relax, you need to stabilize, not just squeezing. Okay? So connecting your pelvic floor with the rest of your core and your body. All right? Good.
If someone were to come to your office for an exam, or a consultation, what would that entail?
So I typically look at it's like a good amount of talking and just making sure that everyone, knows what's going on, we know what's going on. We also ask, tough and weird questions that people just don't think about. And then we'll go into our physical assessment. So I start at the hips, I start with standing. I'll see how your squat is, if you're deviating to your right side, if you're deviating to your left, if you can do a deep squat. I'll see your hip hinge or deadlift, or bend and snap. I'll also check out your plank. I'll check out your SI joint, and then I'll put you on the table. I want to see how your back moves, how your hips move, how strong your glutes are, how strong your abs are, basically. And then I'll pass around the belly. I'll see if there is tightness, if your diaphragm is released, if your ribs are flared, or if they're too tight and compressed. And then we do a vaginal assessment for the pelvic floor if you're comfortable. We don't have to, right? So basically what we'd be checking is the tension of all of these muscles internally and externally. If they are too tight, if they are functional, if they do squeeze when you cough, if the reflexes are off. So those are all the things that we would check. And then based off of the assessment, we would give exercises, or we would just say, hey, what can you do in your everyday life? Do you have an infant at home? Do you have to pick them up? Great, bring the infant. Let's just practice picking them up. We kind of work around what you can do.
If you're pregnant, still do the whole.
We typically don't do internal assessments for first trimester. But second and third are totally fine as long as it's clear by your OB. And then we also do birth prep. So we do breathing for birth, different positions, finding out what position your pelvic floor responds best to. So if it's hands and knees, maybe that's the good position where you birth in. If you're squeezing when you're in hands and knees, probably not going to use that, right? Because our pelvic floor can just get in the way with birth and delivery. Any other questions? Nothing else? I'm Alexa. Thank you for coming. Pelvic floor is so important, and I'm so happy that you all decided to come. But I have cards and stuff up front if you ever